Hey, Michael Phelps here. I want to tell you a bit about online therapy. Online therapy is not about time and place. It's any time and any place. Did you know that over 50% of Americans struggle with their mental health? I'm one of them. And that's why I'm here to tell you about online therapy and how it can change your life. Online therapy is just as easy as joining a video call or texting with a friend. Only you'll be talking to a licensed therapist from your device on your schedule. Talkspace is more committed than ever to making therapy accessible and affordable for all. Go to Talkspace.com and start working with a licensed therapist today. Brought to you by Talkspace, therapy for all.
Get $100 off your first month of Talkspace therapy with coupon 100 for you.
Orangutans. They're beautiful, playful, and majestic, and disappearing. Every day, as many as 20 orangutans vanish. They starve to death when their homes are destroyed or are killed when they stray into villages in search of food. International Animal Rescue is fighting for the survival of the critically endangered orangutan. But we can't do it without you. Please visit internationalanimalrescue.org and help us save orangutans before it's too late. That's internationalanimalrescue.org.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here this evening with Dr. Millicent Ravello. Dr. Ravello, how are you doing?
I'm doing very well. You know, I have to say, as these podcasts go on, your intros get more and more ebullient. like you're really getting into this intro thing.
That's what I've been thinking about being ebullient.
I'm Dr. J. Calvert.
So this is a good thing, I think. It sounds good anyway. Happy to be that way. Yeah, I think as we do more podcasts, I have more interest in really focusing our information for our listeners. And I think our topics are becoming more focused, more detailed.
Yes, definitely.
And that makes me happy.
Yeah, we started it off with, sort of a shotgun approach, broad general information on these topics, and now we're sort of starting to break them down into their individual components.
Well, and that's good. I think our listeners are digging it. We are gaining listeners, which is very helpful. We're not just speaking for ourselves, which is good.
Kind of, a little bit, sort of.
But I really think that if you want to dig into a topic, and by the way, you can direct message us for the listeners if you have a topic you want to hear about. And we've taken a bunch of suggestions, like the hairline lowering was a suggestion, fat grafting of the breast. And we kind of do the stuff that we're kind of doing in the OR, too. We talk about that a lot. And so you have a few gynecomastia cases coming up.
Right. And that is usually how we pick topic. It's like, oh, what am I doing a lot of these days? Or what's coming up for me? Let's talk about that. So yeah, I did a couple weeks ago. I have another couple coming up this month. So I said, let's talk about gynecomastia.
So gynecomastia, and in fact, I had a patient contact me about the cost for gynecomastia because his insurance isn't interested. And gynecomastia is basically like managing male breast tissue, which,
I was waiting for it. Come on, just say it's man boobs. It's man boobs.
Well, I wanted you to say that. I just work here. Yeah, it's all about man boobs.
Yeah.
Yeah, it's a heavy duty topic because every guy has breast tissue.
Yes.
The question is, does it look bad? And is it unmanageable and unattractive and bothersome?
And to what degree do they have it? Because that's the thing. Men can get breast cancer. This is a known fact. And it is in men who do not necessarily have maybe visibly what look like man boobs, but yet they can still get breast cancer because every person, man or woman, has a little bit of breast tissue in the chest area. And so in gynecomastia, that breast tissue is overdeveloped.
Yeah, it's man boobs, like you said. And they can be big. I mean, you can get guys, and there's a lot of things that cause it. We know that there are things that, enhance the growth of male breast tissue, which is, not great. But there's a lot of guys, I think it's probably 20% have, some gynecomastia through puberty. And then it can actually be about the same through adulthood. I mean, I know